Ladies and gentlemen, thank you for standing by. Welcome to a diverse, high-quality, and equitable early childhood system webinar. During the presentation, all participants will be in a listen-only mode. If you'd like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. As a reminder, this conference is being recorded Friday, July 19th, 2013. I would now like to turn the conference over to Michelle Stover-Wright. Please go ahead.
Thank you very much. Hello, everyone. My name is Michelle Stover-Wright, and on behalf of the BUILD Initiative and our presenters, I would like to welcome you and thank you for joining us for today's discussions. State and communities across the country are working to develop high-quality, effective early childhood programs and systems. This includes systems that are responsive to families from culturally and linguistically diverse backgrounds. As these efforts and discussions move ahead, we are continuing to identify lessons learned and ideas for next steps in assuring an equitable early childhood system. One approach is to provide strategies that promote and measure family and community engagement. Our discussion today will begin with Eva Marie Shivers, who will share some of the lessons learned from BUILD's QRIS Diversity and Equity Project and how those lessons might inform system development. Then our Minnesota partners, Betty Amarita and Richard Chase, will talk in some detail about family and community knowledge systems, what we know about family and community engagement, and strategies to ensure strategies to measure that engagement. We really do appreciate your time this afternoon and all the insightful questions you provided when you registered. There's clearly a lot of good thinking and planning happening in communities and states across the country. Before we jump into the webinar, I do want to let you know that at the end of the webinar, on the last slide, there will be a link to a web page. On that web page will be a recording of this webinar, as well as a variety of resources that our presenters have recommended to be available to you, as well as the tools and the paper that were sent out to you prior to the webinar today. And as they mentioned, please ask questions in the box, and we will get to them as we can throughout the webinar time. We want to be able to respond to questions and let our presenters answer questions as time allows. Our first presenter is Dr. Eva Marie Shivers. She is the director of the Institute for Child Development Research and Social Change at a nonprofit action research firm at the Indigo Cultural Center in Phoenix, Arizona. She has served as a principal investigator on numerous research studies that involve participatory-based research with community agencies and diverse cultural communities. She also provides research consultation to federal, state, and local policymakers, especially around the issues of how to create culturally responsive early childhood systems. We're very pleased to have her, and I'll turn it over to Eva.
Thank you, Michelle. Good morning, everyone. We're all excited to be sharing more information about this topic, and really excited about the numbers of people who signed up for this webinar. I think it is a great indication that there is still a lot of interest in this issue. And what I'm going to be talking about this morning is sharing some of the findings and some of the lessons that we learned as a result of a project that BUILD conducted as they provided technical assistance to different state teams. And this technical assistance was specifically around working with quality rating and improvement systems on issues of diversity and equity. BUILD contracted with our research firm, Indigo Cultural Center, to conduct the evaluation. And we have a really big report that we generated, but in the interest of time, I'm just going to highlight some key findings. So we always like to start by citing some of the background research for why this issue really deserves to be really attended to in an intentional and explicit way. One of the questions that we asked as you signed up for this webinar was your perception of where your own state is in attending to these issues. And many states are still really needing to see more research. They need to see synthesis and citing of the research that shows why attending to diversity and equity in our early childhood system building is important. So here are just a couple of findings from research, some compelling findings that remind us why it is so important that we not just think this issue is going to be taken care of by itself, but why we need an explicit emphasis on this. We know that disparities for children of color, low-income children of color, begin really just as soon as they enter school. We're seeing disparities, and some evidence cites that the disparities are evident as early as 9 months. We know that social and family disparities exist at birth and continue throughout childhood. Minority children are likely to be in low-quality child care and experience less stimulating interactions, even when we control for income and maternal education. And we know really, and the point of our call today is that it is important to focus on early care and education, not just the environment, but our systems that we're creating, which can further exacerbate these disparities and inequities if we don't attend to them in an explicit and intentional way. So now I'd like to turn to BUILD's role in all of this. BUILD has had a strong history in raising awareness on the issue of diversity and equity in early childhood systems building. And if you go to their website, you can see many briefs from the past decade that attend to this issue. I'm not going to go back that far in reviewing what BUILD has done, but a couple of years ago, around the time that that Round 1 Early Learning Challenge grants for Race to the Top, around that time that states were working on the application process, there was an ignited interest in this area. The way that it was referred to in the application was promoting school readiness for children with high needs. So we found states really working hard to get more information and cite more evidence and create frameworks for how they would be creating systems and developing systems that were culturally responsive. And around that time, BUILD did host a couple of webinars on the issue. There is a very strong interest from states in this issue. In response to those webinars, BUILD did several things. They convened some stakeholders to discuss more of a national agenda on issues of diversity and equity. Around the same time, they also released RFPs for state teams that wanted some TA. Specifically for diversity and equity focus in their system building. So what we did know about this project, the TA that was delivered to states, is that a majority of state early childhood systems were not currently adequately addressing the needs of children from diverse backgrounds. A couple of years ago, a review conducted by Charlie Bruner and his colleagues found that the 16 states at that time that had a fully developed QRIS, none of those states had a specific component or subscale that addressed dual language learners and children from diverse cultures and how well they were fostering an appreciation of race, language, culture, gender, and ability differences. In fact, only 3 of those 16 states even mentioned these issues in some of their other components on their QRIS. So we already knew that this was not being addressed in state early childhood systems. And BUILD also knew that most states would stand to gain from incorporating an explicit and intentional emphasis on equity and diversity. And so the way that the TA was designed was to bring together a group of national experts that had expertise in both the content of diversity and equity issues and also expertise in process in terms of helping state teams do this important work. So here are some of the key components of the TA project that was delivered. It was funded by the W.K. Kellogg Foundation, and the project had 3 distinct components. The components were distinct, but you'll hear a little bit later on how some of them did overlap. First, there was a train the trainer aspect, and 15 states participated in this. And this was really where states were able to bring 2 representatives to attend a Train the Trainer series that focused explicitly on race and dual language learners in early childhood. So that was one component. Another component was something that was called a learning table, and 8 state teams participated in that, and they convened once a month. And this learning table was hosted by Camille Catlett at Frank Porter Graham. And through the learning table, there was a launching pad where state teams had access to amazing resources and PowerPoint presentations. And they even had homework that the teams were required to do before and after each session. And it really, on each of the monthly calls, there were opportunities to discuss across state teams, so there was a peer learning format to that as well. Then the last component was something that was called customized technical assistance. 7 states participated in this component of the project, and these 7 state teams were each assigned a technical assistance provider. And the TA that was provided really was tailored specifically for that state and where they were in their own process of their QRIS development or other aspects of their system development. And what was interesting about this project was that the components were not mutually exclusive. So some of the states had customized TA providers, but they also were able to participate in the learning table. And some of those states also participated in Train the Trainer, as well as having learning table or customized TA. So there was some overlap in terms of what states were able to receive. So I'd like to share with you now just a summary of our findings. What we found, and this probably is not a big surprise, is that the integrated TA approaches were really very successful. So as you can imagine, those state teams that participated in the learning table and had an individual TA provider who worked with their state team specifically really were able to make a lot of changes and move forward on their agenda around diversity and equity in their early childhood systems building. And another really big finding we saw, and this again also won't be a surprise, but the developmental stage of a state's QRIS, meaning, were they just at the beginning stages of implementing and developing their QRIS, or were they more advanced and more involved? Had their system been around a little bit longer? The developmental stage was really a big indicator of how well states were able to use this customized TA or use the information that they found in the learning table and turn it into some action. And as you can imagine, those states who were a little further along in their QRIS development were able to really sink their teeth into this work and make some really great gains. Another important finding is that the political context for embracing issues around equity and diversity were also predictors of how much progress the state was able to make. So you can imagine in states where an acceptance and awareness of the importance of these issues around disparity, where that was already embraced, happening, there was already that foundation for understanding how important that work was in those states. Those teams were able to make more traction in this area. So here are some examples of the kinds of things that we saw across state teams, things that changed as a result of participating in this project. We really did see a broadening of early childhood stakeholders, groups that were already convening to discuss systems development for early childhood. They broadened the group of stakeholders to include groups that were representative of different cultural communities, family organizations, not just the what we call the usual suspects that we normally see around these tables. The stakeholders were really broadened. They became more inclusive. What we also saw as a result of the TA was an enhanced political context for doing this kind of work. Some of the states brought in a very experienced facilitator who could facilitate a large group of stakeholders and have these really important and hard and difficult conversations around race, language, immigration, and what it means for systems building. So there was more discussion and more action on these areas around diversity and equity. Another really common approach was that state teams, they convened to adopt principles. They adopted common language, common definitions, shared vision. And again, this was usually a starting point for many state teams, and often these state teams benefited by an outsider from their TA provider coming in and helping them facilitate these conversations. And when they would hit a roadblock in making progress on some of their actions, the facilitator would sometimes bring them back. Remember, this is what we have agreed on. This is our common definition. This is our shared vision. So always kind of returning to those foundational principles that they adopted early on in their process. That was a really powerful way that the TA providers were able to help state teams move forward. And then finally, a lot of states, when they did submit their original applications, they all wanted to make revisions to their QRIS standards and indicators. And indeed, several of the states were actually able to make some of these changes. But again, they didn't come in right away able to make these changes. Their facilitator, their TA provider, started with them from the very beginning by talking about common language, common definition, shared vision, and it was through that process that they got to the point where they were able to make revisions to their standards and indicators. As well, some states developed some resource materials to go along with these revisions. And the resource materials they developed thinking that these could be useful for coaches, consultants, other trainers who were working in child care settings. So some of the common challenges and barriers we saw in this project, we conducted interviews with key members of each of the state teams, and I think for those teams that didn't make as much progress as they had wanted, or those teams that thought, okay, now that the TA has ended, I'm not sure that we're going to be able to keep moving forward on this. There was this common perception of not having enough time. And what they usually meant by that is that for those of us who are in the early childhood field, we often have many responsibilities, and the hats that we wear can sometimes span across many different projects. And this same idea was true for those state teams that participated in this diversity and equity project. These members of these individual state teams wore different hats and had major responsibilities. And when they would take a look at an average work day, there was a perception that this work was important, but there was just not enough time in the course of a week or the course of a day to attend to these issues. And so, it led to other discussions about equity and diversity, this focus still being seen more kind of as an add-on to our work, as opposed to being fully integrated into all aspects of our systems building. And so, as states were thinking about moving forward and continuing this work, a big question for many of the teams was, how do we, not just those in the state team, but how does our team and how do we help others see this work around diversity and equity not as an add-on, but really essential to achieving our missions and our systems building efforts. What we also saw happen, and this is quite exciting as a result, is we are starting to see the evolution of this next phase for, say, some of the state teams that are continuing to work on equity and diversity. So many of the state teams are saying, okay, we wanted to start at a systems level, more of a macro level, looking at our indicators, looking at our our frameworks for our systems building. Now they're ready to drill down and say, okay, now how can we support our technical assistance providers, the coaches, the consultants, the trainers who are in child care settings? How can we help them deliver this content? How can we develop tools for directors? How can we develop tools for teachers? So while there is still, I think, a large number of states who are still at the beginning of even framing this issue in their systems building effort and agreeing on common language and common definitions and principles, I think there is a smaller subset who are now ready for another round of TA, the next phase of TA. And they're saying, okay, fine, we got it. We have buy-in from our stakeholders. We've got our common definitions. Now we need to start to implement these ideas. Now we want centers and family child care homes to start making progress on these indicators, and we need to give them resources. We need to send them coaches and consultants that can help them do that. So I think that is very exciting that we're starting to see this group of states able to move forward in this area. But I think it's still important to think about who, despite all this wonderful work that's happening, who is being left behind. When we think about participation and engagement of all children, and I like to borrow a term that I hear my colleague Camille Catlett at Frank Porter Graham say all the time, the engagement of each and every child, the ability for each and every child in our system to be able to benefit from all of these enhancements we're spending our time developing. What else do we need to consider? When we think about family engagement, I think most of the time our thoughts go to how can families be more engaged on a day-to-day basis with their child's education, with their child's teacher. How can we get them more involved in the center? But I think it's really important when we think about family engagement to define this very broadly. When we think about our systems building conversations, do we have voices of parents? Do we have constituencies of parents that are part of those conversations? When we think about developing leaders in our early childhood work, are some of those leaders parents? Are some of those leaders speaking on behalf of parents? And are they the parents of groups that tend to be marginalized? When we think about our programs, there are some researchers, including myself, that argue when you have a culturally responsive program, family engagement comes along with that. When programs are focused and are intentionally and explicitly wanting to be culturally responsive, they also tend to really focus on family engagement. When we take a look at our cadre of TA providers, our quality coaches, our consultants, our trainers, how do we increase the capacity to have more diverse TA providers? How do we do that when we look at our professional development system? Who's coming into these roles, and how do we develop more capacity so we have more diversity there? And then finally, and this is not a small point, but finally, when we think about our marginalized communities, our communities where we tend to have still many children from immigrant families, many low-income children of color, children from refugee groups, children in rural settings, still so many of our children, especially our infants and toddlers, are in family, friend, and neighbor care. Currently, it is a challenge for us to develop our systems and to know how to include these children in our systems building efforts. There are some states, and including Arizona, who have wonderful funding for family, friend, and neighbor programs, but still the systems building efforts don't quite know how to integrate this group of children, this group of families into those efforts. So I think it's a conversation that we need to reignite. We were talking about it a lot a couple of years ago. It seemed to have dropped off a little bit. But I will end my discussion here by just encouraging all of us to think about when we think about the children who are being left behind currently right now in our systems building efforts, there is really it's really hard to find examples of good integrated approaches that include the children in family, friend, and neighbor care. So that the next steps that are happening, just so that you know what to look forward to, BUILD is working to finalize an online toolkit that will be available to states later this year. And that toolkit will have many wonderful resources, and will have examples of what other states have done as they revise their standards and revise elements of their professional development system to be more intentionally and explicitly focused on diversity and equity. BUILD is also working with Child Trends and the Child and Family Policy Center to synthesize and disseminate more research on this area, and is currently seeking funding for another round of technical assistance for state teams that want to focus on diversity and equity.
Thank you very much, Eva. I want to invite folks to type any questions for Eva. We're going to take a few minutes for questions specific to Eva's presentation. So feel free to type in any questions. We did get a few questions while Eva was speaking, and so I just want to, one of the first ones was a question around who were the learning tables comprised of and who attended the Train the Trainers.
You mean the states or the types of stakeholders that we tended to see?
I think both questions. There was a question on which states were involved, and then another question around who were the stakeholders that participated in those learning tables in the state.
Okay, let's see here. So I need to pull up my report to get the states. Well, I guess I can start with the stakeholders. Every state team was a little bit different. For the Train the Trainer, the stakeholders that usually were sent tended to be people whose role it was to facilitate trainings in their state or to actively promote certain trainings in their professional development system. Some of the people were indeed trainers who would then go back to their state and be able to train other trainers. Some of the people that came to the Train the Trainer event were state administrators, so there was definitely a mixed bag there. For the learning teams, as well as the teams that participated in the customized TA, the stakeholders tended to be leaders in early childhood systems building efforts. So for example, we might have somebody from a State Department of Education present. There was usually somebody on the team who had a leadership role in their quality rating and improvement system. Sometimes we had Head Start state administrators at the table. Child care resource and referral agencies usually had a presence on the state teams. So again, it was mostly leadership. When we think about our typical stakeholders, it was the people who are really actively designing and developing those systems. There were a couple of states that were kind of thinking outside of the box and invited people from specific cultural communities, from representatives from African American groups, representatives from Latino groups in their communities. So there was, I think, one or two states that intentionally kind of broadened that group. But for the most part, it's our stakeholders, leaders that we normally see around the early childhood tables.
Great. Thank you very much, Eva. Another question is, how do you measure growth in children or increased access as a result of this work?
Oh, that's a really great question, and I hope that we get to be able to answer that question one day. I think where we start is we start by tracking what kind of process states are using. So we start by looking at policies and how many states have developed specific subscales or components or indicators in their rating system that attune to these issues. And then we start to look at another level where we say, okay, so now that we have indicators, how many centers and homes are actually making progress in this area of culture, race, and how well are they doing? What are the barriers? what tools are they using, who's helping them. And so we then really take a look at the professional development system that is helping centers and family child care homes do that work. And then finally we're able to then take a look and say, okay, in these centers, in these homes where we have teachers and providers using these practices with children or engaging with families in a certain way, or hiring certain teachers and administrators and having lots of rich discussions around these issues, how is that then impacting children's experiences? And I conducted a study with another colleague, Kay Sanders. She's at Whittier College in California. We were very, very interested in this question of children's outcomes. And we did a study using longitudinal Head Start data. And we did find some interesting results. We looked at cultural congruency between home and Head Start settings. And what was interesting is that we didn't see an impact on child outcomes while they were still in Head Start. We didn't see an impact on children until they were in kindergarten and first grade. So I think we do need more of these studies looking at the child level. And it might be that we don't see the true impact on children while they're still in child care settings. It might show up later in their early years, but I think it's important research that we absolutely need to continue to conduct.
Absolutely. We have a time for a few more, Eva, so I appreciate it. Here's another question that says, you mentioned that the equity and diversity focus has not fully integrated all aspects of system building work. And the question is there a reference list that outlines all of these aspects of system building?
The question is there a reference list?
Yep. Is there a reference list? Is there some sort of resource to support that?
Right. I'm trying to think. I know that I did post a couple of resources that will be available on the Build webpage after this call, and I don't remember whether those resources pointed to specific levels of systems building. But that could be, I'll have to take a look and see. But if there's not, I will specifically look and see if I can find something that details all the different levels of systems building and where we will be able to make an impact. I think the closest thing that we have right now, and one of the best resources, is something that we call the living document at Build, and that is on the web page. That participants can access after this call. And this living document was pulled together by Charlie Bruner, by Indigo Cultural Center and other researchers around the country. And we do take a look at different domains of system building, major domains in early childhood development, and we provide some compelling research for why this issue is important, why it matters. And our hope is that this document could be used by various stakeholders and states to start this process, these conversations in other states around the country.
Yeah, and thank you, Eva. And I'm glad you mentioned, because it is one of the resources that will be available on the web page, and that link will be provided at the end. I've also gotten several questions about whether the PowerPoints will be available. Those will also be available. One more quick question, and then we'll move on. There'll also be an opportunity for more questions at the end of the webinar. But the question for you, Eva, is what is the role of higher education in this area?
All right. Oh, boy. I could go on and on about this. And again, in the living document, we do have a lot to say about higher education. But in terms of training teachers, pre-service teachers, as well as teachers that are already in the field and continuing their education, I think that it's important that we look at the content of the courses that our students are taking. And I am a firm believer that the content, we don't just focus on this process of having these add-on classes, a separate class around cultural diversity or a separate class around language. I think that it is much more effective for our teacher training when we infuse these issues throughout the entire early childhood curriculum. And there was a study that was conducted by researchers at, I believe it was University of North Carolina, where they found that faculty and universities who tended to have more explicit emphasis on culture and language, those institutions tended to hire more faculty of color. So I think this is also a really important trend to pay attention to. Not only do we, the role of higher education, not only do we need to think about recruiting and hiring more faculty of color, I think that when we come into higher education, these issues are already on our mind because usually because of personal experience and our current research agendas, we know these issues matter. But when you have more faculty of color and faculty that speak different language and have multiple perspectives, it can also really drive the focus for other faculty as well. Please don't misinterpret my statement to mean that only faculty of color can do this. I think the point here is that if it's just business as usual and we don't have somebody who's bringing this issue to the attention of other faculty, these issues normally don't get addressed in a meaningful way. So again, I think there's a lot I could say about this. The living document does have a section around higher education, and we still have a lot of work to do.
Thank you so much, Eva. I apologize we didn't get to everyone's questions, but I do want to move on to our next presenters. And like I said, there'll be some further opportunity for questions at the end. Our next set of presenters are first Betty Amarita of Development and Training, Inc. She's known across the country for thinking and work advancing early care and education policy at both the national and state levels. She is co-leading the Family and Community Knowledge Systems Data Project and is really well known for her work around family, friend, and neighbor care. She will be presenting with Richard Chase, who is a Senior Research Manager at Wilder Research in Minneapolis. His research focuses on early childhood policies, services, and indicators, and has really worked with a focus on equity and inclusion. For nearly 30 years, Richard has worked with diverse community-based groups and government agencies to design and carry out useful studies focused on outcomes and improvement, and we want to welcome both of them. Betty, I believe you're up first.
Betty, make sure you unmute yourself.
Can you hear me?
Yep, there you go. Thank you, Betty.
Okay. Hello, I'm Betty Amarita. Thanks so much for joining us for this important conversation on family and community engagement and allowing Richard and me to introduce you to two tools that we've developed to measure it. Right now, we're piloting the tools in Minnesota with support from the W.K. Kellogg Foundation. When we heard that over 750 people registered for this webinar, we were so excited because this tells us that there is a great community of interest out there and potential colleagues who are looking to get involved if they aren't already. So let me start by telling you a little bit about my background so you'll understand the lens I'm wearing. I'm an ideation and strategic change consultant. I'm frequently invited to be part of high-functioning teams that are working to introduce new policies, respond to unanticipated changes, and to reposition initiatives. I work across sectors, and I do a lot of work with foundations. For the last 14 years, I've worked in early education at the state and national levels. I've also worked extensively in economic development, urban and rural, very different environments, promoting business development at local and state levels, as well as nationally and internationally. All of these sectors, child development, business development, the economy, are intertwined in early education and in the lives of people who provide it, from families to home providers and child care centers. This is a professional interest that is driven by personal experience and a profound curiosity and respect for the amazing lives that people live. In fact, it's actually how my interest in family and community knowledge systems began. I grew up in rural North Carolina, and I had relatives everywhere. My mother was the youngest of a blended family of 18. Her mother and her father were both married before, both had 6 children. Their spouses died. They married each other and had 6 more. And my father was one of 12. So aunts, uncles, and cousins were like leaves on a tree. But the families were very different. On my mother's side of the family, defining yourself on your own terms was the most important thing. And when they visited, it was to be with you in whatever you were doing, not necessarily to talk. In fact, if you talked about yourself, your ideas and accomplishments, you were considered to be a fool. So I learned a lot about qualities of silence and subtlety of movement, like how to work in the kitchen as a junior person with powerful senior older women, doing what was needed, being just in time, getting things done without getting in the way. In my mother's family's view, educating yourself was important, but didn't necessarily involve school. And laws, rules, and regulations were thought of as suggestions. So I learned a lot about thinking outside the box. On the other hand, my father and 10 of his 12 siblings were all college educated. And if you didn't talk about your ideas and accomplishments, you were considered to be a fool. All of the cousins knew that if you wanted to go to college and you couldn't afford the dorm, you stayed with Uncle Nathaniel in Durham, who lived 3 blocks from the state college. And if you wanted a summer job, you stayed with Aunt Marie in Philadelphia, who worked for an employment agency. So we were like an industry unto ourselves, and there weren't very many problems that together we couldn't solve. I learned a lot about working with people I agreed with and also with people I didn't to get things done. And I learned at a very early age to navigate very different landscapes. And I cannot tell you how important those skills have been to me in my professional life. Well, that's my story. And we all have our own lens and our own compelling stories. And I want you to think about it. Did you have an experience as a child that gave you a powerful life lesson from what people said or didn't say in your family community, or what they did or didn't do? This is what family and community knowledge systems are. They are the formal and informal ways that children learn in their home and communities. Next slide, Richard. Thanks. Family and community knowledge systems are rich and complex. They are essential to children because they are the glue that holds family and community together. They contribute to the resiliency of children and families, and they are at the core, the very heart of effective families and communities. With support from BUILD, the Knowledge Fund, the Minneapolis Foundation, the Blandin Foundation, and Wilder, the family engagement tools were developed out of themes that emerged from community dialogues that we convened in cultural communities across the state of Minnesota. Those communities included Ojibwe, German, Latino, Norwegian, Swedish, African American, Hmong, Somali, and Irish. We looked at common themes across all the groups and developed these survey questions based upon those themes. These are the 3 things that people cared most deeply about. First, people wanted their children to be good people, to have a moral compass, a sense of right and wrong. They wanted their children to have a positive sense of themselves and their culture, and to be resilient regardless of circumstances. And they wanted their children to be able to understand and interact effectively with the social networks and institutions that are an integral part of their communities. There were some interesting similarities between people in small towns and rural areas and communities of color in urban areas. Both felt that they had to make extra effort to instill a sense of self in their children and pride in their ethnic or rural culture. So, next slide, Richard. Let me be clear. The families who participated also valued academic skills and achievement. However, for them, these skills were embedded in life skills. They were concerned with the whole child and were thinking both and, not either or. They saw academic skills as contributing to life skills. Next slide, please. Richard, thanks. The range of knowledge and experience in family and community knowledge systems is vast. It travels social networks and can be local, regional, national, and international in reach. It's an enormous underutilized treasure. And for the most part, this treasure is not reflected in our databases, much to our loss and to the detriment of children. The 0 to 5 population is increasingly diverse. A majority of babies born today are children of color, and by 2030, more than half the population under 18 will be children of color. Children are embedded in these rich knowledge systems. We want the engagement tools we've developed to help make family and community knowledge systems visible and to connect them to formal educational systems so there can be multidirectional learning, top-down, bottom-up, diagonal, and lateral. The purpose of the tools is to make space for that kind of knowledge in our public systems and to institutionalize the space so that it's always there on a par with other spaces. That's our motivation in this work, and these are our goals. To ensure early childhood data systems promote inclusion and equity, to bring new dimensions of quality and accountability to the quality ratings of early care and education programs. It's a great opportunity to generate new knowledge and more dynamic collaborative support networks for the benefit of all children. Richard?
Thanks, Betty. This is Richard Chase. So as Betty said, we believe that the family and community knowledge systems are a new domain or dimension of and for assessing healthy child development and quality of programs. That they actually are a domain that supplements and enhances other domains, such as language and literacy, social emotional development, and on the program side, the curriculum, the staff education and training. They supplement and enhance. They don't replace them, but they're new tools as a way to bring family and community perspectives into the equation. As Eva talked about earlier, all of the other systems that intersect with families, education, health, child welfare, employment, all these systems produce disparities and inequities. And these gaps in achievement and well-being, they're really aptly more considered as opportunity gaps or access gaps. In a lot of my work, that's why I've been talking about how we must invest in babies and families and communities to prevent these gaps. And much of the early childhood research and economic studies that I've done on the return on investment and the cost of not investing in healthy child development, these are centered on providing objective evidence for preventing these gaps. But I think what we're talking about today is a fundamental new gap, a different gap, and it's the engagement gap. It's equally as important as that opportunity gap. And I think by the large interest in this webinar, I'm assuming that there's some kindred souls out there besides my colleagues in the room next to me. So as Betty said, we have a grant from the W.K. Kellogg Foundation. We're currently piloting these two tools, and you've got copies of those in your email. The early childhood assessment tool, it's got 14 items, and it asks, to what extent does your family do various things or have various things? And the quality rating of early childhood programs, that's 15 items that has, to what extent does this program? So right now we're in the second year of the pilot testing the tools in their use. You saw it's a 4-point scale from a lot to not at all. We worked with 4 communities this first year, and now we're going to be working with 4 more in the next year. And at the end of the webinar here, there'll be contact information because we're really looking for additional partners to help us enhance the data we have collected so we can do some additional analysis with some more data and more communities. The program tool is completed by program staff, sort of in the spirit of reflective practice, as you'll see in a second. So Betty will say more about this later, but we have found that the tools require some instruction and guidance to administer, because the content is somewhat nuanced and complex, and it's actually new ways of looking at families and communities we have found as we've talked with our first pilot programs. And an example of this is our definition that's sort of inclusive and growing definition of what community-based means. And I know that I often take it for granted or as self-evident just what we mean by I work with a community-based program or we're doing something that's community-based. But our families and the providers in the first pilot, they wanted us to really be more specific of what that meant, and they provided examples of what that definition was. And it's quite inclusive. So it's faith-based institutions. It's geographic or it's place-based. It's part of your neighborhood and your organizations or community centers. It's also where people of the same culture and ethnicity gain recreation or empowerment or work together to solve problems with clans and reservations and powwows. They're social gathering places, including shops, restaurants, or clubs. They even wanted to include bars, but they didn't want to bring kids to the bar, so they made us take it off the list. And really, it's any place a person feels connected and supported. So we're going to look at the tools now. And we only have time to look at the categories or constructs or the factors that we're testing in each tool, and then an example of the elements or indicators that make up one factor in each tool. But again, you've got copies of both tools that were sent in your reminder email, and they'll be available on the Build webpage and the Wilder Research webpage as well. Oops. So the early childhood assessment, the science we're looking about. So these aren't coming out of thin air. These do have roots in Search Institute's assets. They have roots in the Strengthening Families Protective Factors, in the Race Matters work, Benny Casey, the culture as a protective factor. What we're saying was that an important aspect of early childhood development include that the family and the extended family has support and connection, that there's a transmission of moral and cultural values, and that they actually have experience with the institutions and programs and agencies that they come in contact with that are responsive. Let me give you an example of what we mean by that. So modeling and teaching honesty, respect, a moral code of conduct, we think that's as important as teaching letters and numbers. Or growing up in an environment in which messages about self-worth and identity that are positive and consistent and embedded in all relationships within the family and the community, those are as fundamental as basic nutrition and immunizations. So we view these things as on par with all the other things we're concerned about with regard to healthy child development. For programs, so quality programs would work hand in hand with families to build that character and integrity, to nurture honest and respectful children. So quality programs teach children to read and to get along with others and to follow directions. And in a pluralistic society, they also help children develop a sense of self, a sense of who they are, and self-respect through developing connections within their communities, within their cultural communities. And they show they understand and value community through words and deeds. These are the qualities and why we think are important for programs. And I think these are why so many young children are in family, friend, and neighbor care. Because these are the kinds of qualities that many family, friend, and neighbor caregivers provide. These are the indicators that programs understand and value community. The first one actually matches one in our child development assessment. in which the parents rate if they feel invited to do this. But we think that quality programs will be inviting families to talk about the skills and abilities and capacities their child exhibits at home or in their community that are related to what Betty was talking about and the experiences and knowledge they gain sort of in the home, on the job in the home. And they have a way, a method to actually change and adapt all the things they're doing, how they've been thinking about how the program, the frameworks, the requirements, the methods they use, all the practices and strategies that they change and learn from families together to make things work. And that beyond that, they effectively work with families to combat and counteract anything that's against the child's sense of self-worth and identity or a lack of some positive images and interactions that affect that child. Back to you, Betty. Betty? Betty?
Sorry, can you hear me now?
Yep.
Hey,
Hello.
Betty, speak
Hello?
up. Some folks are having a little trouble hearing you.
Okay, can you hear me now?
Yeah, that's better. Thank you.
Great, okay. There are multidimensional systemic uses for the tool. A framework is created for supporting children's transitions between home and other learning environments. Families and program staff begin to understand each other better and to value each other's perspectives more, creating pathways of understanding that children can rely on as they move back and forth between these very different environments. Secondly, feedback loops are institutionalized between families, child care centers, agencies, and rating organizations. When the tools are used on a regular and periodic basis, because we think this should definitely be more than a one-time situation, but to track these things over time, these feedback loops become part of the infrastructure. The new information that is generated can improve not just early education, but other agencies as well, Health and Human Services, as some of the parents and staff pointed out. Parents and staff also wanted to know how we could help that process to happen. So they are really interested. They could see the applicability of these tools to other agencies in which they were also engaged. Next slide, Richard, thanks. These are some of the questions that were considered in the conversations between parents and program staff that these tools gave rise to. What can be done to strengthen and increase capacity to provide support and connections within extended families and within communities? So talking about the nature of these connections and the ways in which some program activities could be carried out so that these connections are both supported and strengthened was a lively conversation. What are some of the barriers to changing program rules and requirements in response to what is learned from families and communities? And how can those barriers be reduced? There are many instances in which, for example, program staff would say that on an individual level they were being very responsive in their practice to what they were learning from families. But whether or not those individual practices then became part of a programmatic framework was another question. And it's
Excuse
not...
me, Betty. Betty, people think they can't hear you very well. Can you speak louder into your phone, please?
Oh, you still can't hear me?
Yeah, we're getting chat messages. People can't hear you very well.
Oh, gosh, I don't know what to do.
Well, all right.
I'll try to talk a little louder. Is this better?
Yeah, talk louder, yeah.
Yeah, just talk a little louder.
Okay. The new information that is generated by the tools can improve not just early education, but other agencies as well. And some of the parents and staff pointed this out. They really wanted to know how we could help to make that happen, because this kind of information is so foundational, and it goes to whether or not programs and services are structured in such a way, delivered in such a way that they support families and communities, or if they compete with them. These are some of the these are some of the some of the comments made by families and staff members who participated in the joint learning session on the value of the tools. It was really nice as a parent to hear other parents. So the conversation between parents from different cultural communities in some of the learning sessions, it was really extraordinary to hear. Another comment, it sparked interest between parents and staff and brought us together to understand how to have the conversation about what their children are experiencing. The kinds of reflections that these questions provoked and these joint conversations inspired really shifted things, I think, in how a lot of program staff viewed their work, and for parents in terms of being reflective about what kinds of things they were doing with their children. Another comment, it reminded us that we are co-parenting with parents and staff. It was helpful for staff to see what is important to parents and for parents to see what staff is trying to do. Because a lot of times these efforts without these explicit conversations are invisible. Another comment, there are artificial boundaries between parents and staff. The tools help move the boundaries. The tools help bring parents and staff together to discuss values, services, child development, and integrity. They help provide a context for discussion, a beginning point for increased relationship building. So clearly, these kinds of questions that the tools provoke are very different from logistical questions. They call for a far deeper level of engagement. Sorry, Richard? Hello?
This one's yours still.
Oh, sorry. It calls for a far deeper level of engagement within and between families because they're able to reflect on their own practices and share strategies that benefit their children. And for programs that were particularly diverse, it was really exciting to hear staff reflect on how they could bring different cultural communities together to share strategies that work around different parenting practices. A deeper level of engagement between families and staff because they begin to learn from each other as peers, as they begin to acquire knowledge that neither had before. And a deeper level of engagement between program staff, families, and community, with synergies developing that increase the capacity for all.
Okay, so I hope you got from what Betty was saying that through the process of using these tools with parents and their child care providers, so it was matched. It was the parents and their child care providers, and discussing the results of the parent tool, the child tool, and the program tool. It both assesses the extent of engagement and actually creates the conditions for promoting engagement at the same time. So it's not something I think it's a one-time event, but it's a developmental process that can be built in to reflective practice within programs. And it's not just limited to, I don't think, to early care and education settings, but it's applicable really across all systems and relationships between families and programs that get at what's important to families. So I know many of you, when you signed up, you said you were interested in measuring engagement and in engagement outcomes. And these tools, based upon the feedback we got from the 100 parents and 100 providers in our first 4 pilot communities, they told us that it's important when we talk about engagement to advance beyond the logistics of it, the when, where, and what activities to attract parents, to advance beyond which language it's in which culturally relevant curriculum to use. And it's more than involving parents in everyday learning at home or as advocates for their children. Those are all very important precursors to this sort of dynamic, multidimensional engagement. But we found these tools dig beneath that foundation And as you saw in the words of one of our pilot partners, they go deeper to what families really want. They want to be connected and supported in their parenting role, that sort of instrumental level. They want to be respected for their knowledge and experience. They want to be an integral part of program design and decisions. And they want to join forces at the level of transmitting cultural messages and the values of respect, honesty, integrity with their children and the providers of care to those children. These are what families really want, and are at the engagement outcomes, and these are the engagement outcomes measured and promoted in our tools. We can see isolated families moving to being connected, and if they are in a quality program, the families would see the program as part of that support and connection. You can see families having a voice in the design and the decision-making within the programs, and you can see that mutual obligation to have positive cultural messages across all the partners in child rearing. This is what going deeper means for engagement. These are what families really want. So in sum, the signs of healthy child development in program quality, as we're looking at it, can be seen as these levels of engagement: that instrumental support, the authentic partnerships, and then cultural identity and values. These are the gaps in engagement that these tools can measure and, we hope, close. If we've piqued your interest, want to go deeper with us, figure out how to get this to be as effective as possible, if your agency or program is looking to improve your engagement with families, if your state is looking to make your quality rating system more equitable and inclusive, or if you're working on generating buy-in and to frame conversations that value family and community and infuse them in the equation, Betty and I welcome your involvement. We are going to have schedule a webinar training specifically on how to administer and use the tools, so then you can are set free to do that. We want to make sure that you are going to be using them in ways that are effective. So if you're interested in trying out the tools, look for the announcement for that webinar. We'll send it out the same way we sent out this announcement. It'll be probably late summer, early fall. And we hope some of you will do that. If you're interested in having helping us to continue and test to improve the tools, we'd have to have access to the results of the tools you fill out so we can put that into our systems. But we could also work with you. If you want us to do the number crunching and basic data processing, we can get you your frequencies back of your responses. If you want a written report with results and the strengths and the issues that emerge to discuss, we can do that. Or if you want to have individual attention to support, to design and facilitate the learning sessions for staff and families, we can do all that. So we can do it from all to nothing if you want to be involved in the use of the tools. It's up to you. And I know that there's could be some funders on the webinar. You may be interested in helping to underwrite some of these activities, so we'd be happy to hear from you as well. Betty, you have anything to add?
No, I think that does it. I'm looking forward to hearing questions.
All right. Thank you very much, Richard and Betty. We have many questions coming in, so let me just kind of start. One of the questions I think is maybe an easier one to answer. It says, are the outcomes based on the results of the self-assessment tool? So maybe there's a little bit of confusion around that.
Say that again?
Are the outcomes based on the results of the self-assessment tool?
Yes.
Yes. Okay, thank you. I just wanted clarify that. Also, someone wanted just a little bit more detail around how the data is used.
Well, it's interesting. The data is not, we do not present the data as prescriptive. We present reports to the pilot sites, and then we bring together the staff and the families to look at the report And it's up to them to decide, what does this mean? How do we want to use this? What action do we want to take? What plans do we want to make? And I think that was one of the things that really, engaged people. They felt that they were being invited into an arena of decision making that they had not been part of before.
Thank you. Were any of the pilot sites Head Start states?
Head Start sites?
What?
Sorry, were any of the pilot sites Head Start sites?
No.
No? Okay, great. Thank you. Let's see here.
Let me just say, when you get our PowerPoint, these are actually hot links to the tools where you would actually enter data into the tools. So if you're interested in doing that, you should email us to set up a program code so you can get your results back if you're interested in doing that.
All right. Here's another question. It's what happens when community knowledge and value systems, such as the role of women and persons of different castes, are counter to the dominant culture's values of equality of opportunity and inclusion? And how can we use this greater understanding across cultures and communities to produce change?
Well, I can tell you that in some of the conversations, which were quite vigorous, there were instances in which there were different values. And a lot of times what the families were saying is that we want our children to understand our values, and we want our children to understand the values of the dominant culture as well as the values of other cultures. And we want them to be able to navigate well. We want them to be able to make those transitions. So even if there were no, hard and fast conclusions drawn at those, around these kinds of questions, the conversation itself created a dynamic that allowed people to further engage. There were several instances in which at the end of the learning session, people were not ready to leave. Mm-hmm. They continued the conversation. And these learning sessions were taking place for the most part in the evening, after work. And, people had plenty of things that they needed to do, but, that they were willing to stay at the table because they felt that there was such value to talking about this. And I think because a lot of families struggle with that, the acknowledgement of that struggle and to know that, there is an effort to think about this with you, not that there is, a silver bullet solution. So I think that that generated a different level of responsiveness and a different level of confidence.
Thank you. All right, how can this data be used to support funding for quality services for FFN care?
I'm sorry, repeat that, the question.
How can this data be used to support funding for quality services for FFN care?
It's basically focused on how it can be used to ensure that quality rating systems are equitable and inclusive. Mm-hmm. And it started there, thinking about, we collect information about kids at screening and kindergarten readiness assessments, so this is one more tool to use at that time to get a broader view of child development. And we're doing an awful lot of growth in the assessment of the quality ratings of early care and education programs and licensed providers and school-based programs. So it's really designed at that level now, okay, as opposed to at the FFN level.
Could I say something about that as well?
Yeah.
Please, Eva, go ahead.
Sorry. I think it's a really important question about the children who are in family-friendly neighbor care. And I think there is a tendency for many of us to believe that when children are in family-friendly neighbor care, they're going to stay there. but I think it's useful for us to think about the children and families who use that type of care. They are not all the same in terms of their preferences and access to center-based care or licensed care. And so I think the underlying question is, our states are currently putting so many resources and so much attention on early childhood systems building to ensure that all children are ready for school. What does it mean when such a large percentage of those children in marginalized communities are not part of early childhood programs that are directly benefiting from QRIS, our professional development systems, all these other investments? So I think the question that we need to start asking is, how do we start to connect these families to these systems? Or how can the programs that the system funds, like professional development opportunities, community college credits for providers, how can those kinds of programs reach out to some of the family-friendly neighbor providers so that all children, regardless of the setting that they are in, are benefiting from these major investments our states are doing? And I think there are lots of different creative approaches, and I think we need to start gathering information about what states and communities are doing to integrate these families into our system.
I think it's also important, that's why I think it's also important, critically important, to recognize family and community knowledge systems as a dimension of quality, because FFN is part of family and community knowledge systems. It's embedded in that. And I think to the extent that we can make space for this domain of knowledge, for this dimension of knowledge, then we begin to address that issue of how to connect that to larger systems, how to make space and institutionalize that space within our data systems.
In the resources on the Build webpage that you'll look at when you that are referred to, or that you'll be referred to after this webinar, there's a policy brief that Charlie Bruner and I put together around, if we're concerned about healthy child development, we have to think about family, friend, and neighbor caregivers as for whatever systems are providing support to families. So it's beyond thinking of them as early child care providers, but they should be part of the home visiting system in the health department. They should be getting housing assistance. In whatever way that if we're concerned about the health and development of young children, especially kids 0 to 2, for the most part, they're with family, friend, and neighbor caregivers. So we have to think about how we can view them across all systems, not even just within the child care system. So take a look at that brief, and it's from a family strengthening perspective.
Thank you very much. Another question that came in asked if there is a cost associated with accessing the tools or having the data analyzed, and I think you touched on this, but maybe reiterate.
What was the question? Is there a cost?
Sorry. Is there a cost associated with accessing the tools or having the data analyzed?
There's no cost to accessing the tools. You received a copy in your reminder email. If they can't access it that way, there should be copies on the Build webpage, or you can do the link at the end of the on our PowerPoint, so you can access it. The training to use it will be free, but if you would like to have us do any processing or reporting, there would be a charge for that, and we'll have to talk to you about that.
Okay. Thank you. Another question that came in, and can you hear me? All right. Okay. Different cultures have different emphases upon individual achievement, competition, and group membership and collective clan identity. How do we give sufficient value to family knowledge systems that differ from the dominant culture?
I think part of in professional development, particularly given the demographics of the 0 to 5 population, that it's really important that institutions of higher education and professional development training systems recognize that there are skills and techniques that are useful for families who are part of individualistic cultures, and there are a different set of skills and capacities that are important to understand for children who are part of more collective cultures, and to train for both.
And what these tools do is give space to the conversation to sort it all out, so you're supporting all kids.
Thank you. Another question was, were all program types, for example, family, center, after school, inclusive preschool, included in the pilot?
In this first year, one of the pilots was, these were all early education programs. One was on White Earth Reservation. A second was a culturally distinct early education program focused on African American children. A third was a very diverse urban center. It also had an extensive home visiting program. And in this particular program, there was no critical mass of anybody who was culturally dominant. I mean, it included white children, African American children, Somali, Hmong, and also some American Indian children. And the third site was in northern Minnesota, where these were mostly Euro-American programs with, there may have been some, with some diversity, but predominantly Euro-American.
Which include also some licensed family child care providers.
Right.
And is the plan, once you kind of get out of pilot phase, to expand to different types of settings?
I think that's a great idea.
Appreciate that. Another question that came in is, how does this complement the Strengthening Families tool for programs and families?
Well, as you know, as Richard said, you know, the roots of some of this. I mean, we drew from a lot of the prior learning from other entities, and I think Strengthening Families, particularly with its work around protective factors, that work is so important, and I think this is very complementary to that work.
Great. I'm going to go back, and there's a couple of questions for Eva, and then we'll start to wrap it up. I wanted to kind of go back because we didn't get to all of the questions around Eva's presentation. Eva, are you on the phone?
Yeah, I'm here.
All right, great. I just want to make sure. One of the questions was, do you mean to say state teams should include organizations that have a background in dual language education if it's relevant to states' populations, and how important do you think that is?
Well, if we operate under a premise of inclusive leadership, and when we think about who our stakeholders are, who are convening and having these conversations and establishing guidelines and indicators and setting policies and developing coaching academies and professional development systems, I think the more perspectives, the more diverse perspectives we have around the table, the more likely we are to be explicit and intentional about including and integrating a focus on each and every child in our system. And so, and it goes even beyond dual language learners. You know, people who are, well-versed in how to create inclusive systems for children with different abilities and language, and people who understand and know about structural racism, and people who, are representatives of rural communities and are really knowledgeable about how those communities work and operate, and what is most beneficial for them, and how do they build capacity different from programs that are in more densely populated areas. So really, I think it just goes to what is our philosophy of leadership. And when we invite stakeholders, when we create teams, who's around the table? We just take a look. Who's around the table? Whose voices are represented? And I think that's just the underlying premise. I think whenever we are intentional and explicit and more inclusive, I think it leads to enhanced conversations about these issues that are sometimes difficult to discuss.
Thank you very much. Another question for you, Eva. It says you mentioned the facilitators a few times when talking about stakeholders all on the same page. Do you see the skill of these facilitators as key in making progress towards more diversity and equity?
Oh, without a doubt. Without a doubt. And I can say that it was challenging to convene and gather a group of TA providers who could lead the state teams in this way. And I think that, you know, if we're able to secure funding for another round of TA, we have some really great suggestions from the TA providers themselves about what we can do to even enhance their expertise to do this kind of work with state teams. So absolutely, that is key. Without a doubt, it was also one of our major findings.
And this question is for Richard and Betty. The question is, what are some of the metrics that you use?
What are some of the metrics? Well, as we said, each of the tools has 3 categories or constructs or factors, and each one of those factors has several different indicators that make up those factors. So if you look at the tools, they're grouped that way, and you'll see exactly the kinds of things we're looking at with regard to healthy child development and quality programs from a family and community perspective.
And I just do want to remind folks, if you need more information or more details on the tools, they were sent out prior to the webinar, and they will be on the web page that will be linked on the final slide. So I want to thank our presenters and give them an opportunity to make any final statements before we sign off. Any final comments?
I just want to emphasize again, this is Betty Emerita, what an underutilized treasure I think family and community knowledge systems are. And that given the demographic changes in the country, we have to come up with a way of recognizing and incorporating far more different types of information than we currently do. And I think that it will lead to so many more opportunities, both in terms of economic growth and competitiveness. And I think it is an exciting thought to think of what could happen if we do recognize family and community knowledge systems as a dimension that needs to be included on a par with other dimensions.
Thank you.
In early education.
Thank you so much. Richard?
I think you probably could tell by our presentations that Betty and I came at this from different directions and different experiences, but we're really going full steam ahead on trying to do all we can to close that engagement gap, and we invite you to join us in figuring out how we can do that and to further to test and improve our tools so we can get them family and community perspectives really infused into all decisions that affect families and communities. So thank you. This is I got to tell you, if you haven't done a webinar, it's a weird experience because you're only talking to yourself. I'm used to giving presentations where people are nodding. You know, they're nodding. They're nodding or they're like shaking their head no, and so there was no one nodding at me. So I'm hoping a few of your heads were nodding, and you can email us and just say, yes, I was nodding, and that'll make me feel better. So thanks again.
Eva, any final comments?
I think I guess the biggest push would be to really encourage states to have an explicit and intentional emphasis on this area around diversity and equity. Really kind of unpacking everything, all of your language. And, I think a lot about the words that my colleague Camille Catlett at Frankfurter Graham says, what messages does our language convey? And I think unless we have an inclusive group of stakeholders around the table to go through that analysis in an intentional way, I think we miss how families and diverse communities might be interpreting our policies and messages and language that comes out of our current systems building efforts.
Wonderful. All right, I just want to thank our presenters again. You did an amazing job, great information. I also want to thank the BUILD Initiative for supporting this conversation. And I really do want to encourage you to go to the BUILD Initiative website. There's many great resources that our presenters provided for us prior to the webinar. A lot of great things to review and to share with others who are having these conversations in your states. So thank you very much. Have an amazing weekend.
Ladies and gentlemen, that does conclude the webinar for today. We thank you for your participation and ask that you please disconnect your line.